We have a very important panel, we feel, right now. It's about conditions of confinement. It's about the prison industrial complex. And we are going to hear from people who are directly impacted, as well as the lawyers, experts, and advocates who are trying to make real change. And we're going to be joined by an artist that I think everyone in this room knows and loves. So let me bring out part one. We're going to do two parts to this, and there's a great reason for that. So part one of our panel begins right now. Please welcome Cheryl, Henderson, Marcy, Croft, and Gotti. All right, I could start anywhere, but I'd like to start with you, Gotti. We are going to start by discussing this Parchman prison. You've spoken about it, you've advocated on it, and you've also led and supported a lawsuit that's already drawn real results, which we're going to get into. Why was this important to you?
I think, first of all, I grew up in a family where I had family members incarcerated. So I was one of the kids that grew up going to different facilitations, visiting my loved ones. Also, Parchman Prison is like, it's very close to Memphis, so it's like if you pass through one red light, you're in Mississippi. So to me, it's like it's super close to home.
Understood. And Cheryl, this is difficult, but we want to begin with the real people impacted. And just so people know, you've chosen to share your story, which matters to a lot of people. So tell us about your story.
My story is with my son. His name is Chadarian Henderson. He's 27 years old. He has 3 boys ranging in age from 8, 5, and 3. When he was about 19, he ended up selling used stolen batteries. And that led him on the wrong side of the law. But the thing about it is, when we went to court, he didn't tell on the individual who actually broke into the company. So that totally changed everything. He went from having a misdemeanor to a felony. Once he received the felony, they put him in DUI court. He was complying with DUI court at the age of 20. He was on there for about 5 years, and we was always trying to find out, like, why is Chadarian still on DUI drug court when he's complying, he's paying all his fines. His parole officer, Mr. Ricky Scott, back in 20, during the pandemic, my son was working for Nissan, second shift and third shift. He was unable to call Mr. Ricky Scott, which was mandatory due to, them not being able to meet. But my son came home one early morning, was getting his sons ready for daycare, and his oldest son made a mistake and slipped his phone into the tub, and that's when everything started. I, in return, called Ricky Scott, the parole officer. I let him knew that, hey, my son don't have a phone to call you. He's working second and third shift. Therefore, he's working a total of 16 hours. He's very tired, but, he is complying. I'm calling for him. And as soon as, hey, he get a break, he will call you. So that same day, he came over and he arrested my son for not making a phone call. They knew, they had it documented. My son was working at Nissan. He was working second and third shift, 16 hours. That's the only thing my son did. That's the only violation that they said he committed, was not making a phone call.
So you're teaching us something important about how so many of the people who are incarcerated aren't there because they committed a crime yesterday or last year, but because of this system or bureaucracy. Can you tell us what happened to him in Parchman prison?
Okay, in Parchman, he went to Parchman July 19 of 2021. He was there for a total of 13 days. Every day, my son called me, crying out for help, saying, "Mom, I'm here with murderers and rapists. I'm a nonviolent offender. The only thing that I did was not call my parole officer." And he said, "Mom, I don't know why I'm here." My son was violated. He was abused. He was in a cell with non-working door, I don't know what you call it. Please excuse me, because I'm getting emotional. Basically, he was in this prison, this horrible prison that had, Marcy, you got to go. I can't do it.
Okay, that's okay.
And,
That's right.
and I just so appreciate you sharing your story. We've talked about this, and so I think people appreciate it. And we talked.
Let me,
Go ahead. Because you take your time, and as you and I discussed, you talk about it as you go. You know what I mean? So I'm gonna have Marcy. You want Marcy to talk a little bit, and then we'll talk more. Is that okay? Marcy is someone who's been fighting for your family, and who's a very effective lawyer. So Marcy, why don't you, since Ms. Henderson mentioned you, why don't you weigh in a little bit, and we'll just keep talking.
Well, Chadarian was transferred to Parchman from another facility in Mississippi because he had a rule violation there, allegedly, right? And that's one thing people need to realize is, like you mentioned, I think a lot of times when people talk about some of these prisons, they assume that it is the violent offenders, the worst of the worst that are there. And in reality, when you go through there, that's not the case, right? There are kids in there. There are teenagers in Parchman. There are, children in there, and nonviolent offenders, and certainly Chadarian was one of those, and he ended up in Unit 30 at Parchman, which is an open barracks unit, one of the worst there. I think everyone hears about Unit 29 at Parchman, which is certainly one of the worst places I've ever seen or been, but Unit 30 I think might be worse. And that's where Chadarian was, and he was only at Parchman for about 10 days to where he reached the point where he could not handle that anymore. He ultimately was transferred to Unit 29 in Building A, and then he took his life on
Yes.
August 1st. And that, the suicide rate at Parchman, the death rate at Parchman, especially when we first started, when Rock Nation first got involved, was 3 times that of every other facility in the United States. There had been riots. When we first got there, there were people that had not been outside in over a year. There were people that hadn't been allowed to shower in over a month. There were cells that had no power, no water, sewer was messed up. So you can imagine, this is the Mississippi Delta. I mean, we all see how hot it is today in New York and this week in New York, right? So take that heat, put it in the Mississippi Delta, add some humidity to it, and then lock everyone away, and without food, without water, without sanitation. And those were the conditions that we were dealing with at Parchman when all of this first started, when Team Rock first got involved. And so Chadarian, unfortunately, was one of the victims of those circumstances. And it is amazing that you are here and you're speaking out for him and for everyone else that has lost a loved one at Parchman. So.
Yes, thank you. I would like to say something else. And I also would like to say, we're all humans. We are going to make mistakes. And ultimately, my son made a mistake that cost him his life. He did not deserve the treatment that he got. He was a young boy, a father. And when I say a father, not many of our young black men are fathers. My son was there raising his children after the fact. He was there with them every step of the way, every graduation. He was getting out working 16 hours, taking the burden off the mother, getting the boys ready for daycare, taking them to daycare. At that time, I was in nursing school. My son would call me, "Mom, do you need me to do anything for you? Do you need me to make sure the other kids are doing their homework? Do you need them to clean the house?" Like, he was a great father. He was a great big brother. And like I said, he didn't deserve to be in that hostile prison. And also, with him being on drug court, they put so many fines, conditions, regulations, and stipulations on a young man. That's the reason why he was working 16 hours. So he could pay for lawyer fees, court fees, being on drug court. There's a monthly fee you have to pay, all while maintaining his own household. And I think that with Gotti stepping in, using his platform to making or bringing some light on this situation, is going to help. I think change is most definitely going to come with you speaking out, with all the families who are here today that has encountered some kind of hardship with injustice. And I thank you so very much, and I know my son would thank you as well. But I want everybody to also know that it's real. My son called me every day, several times throughout the day, crying out for help. And as a mother, what was I to do when I couldn't help? But I was always calling to Parchment, being transferred. They wouldn't give me any information. They wouldn't tell me anything. They didn't even try to get my son help. As I was telling them, he's going through a mental crisis. He needs someone there to talk to him or maybe isolate him away from the situation. No one ever came to my son's aid. No one.
And you did everything you could, and you faced this against the system, and now you're helping change the system, which I think is remarkable. I really do. And so before we lose Gotti, because as I mentioned in part 2, we're going to hear from the people that are actually bringing the change at a ground level.
Okay.
I want to say to Gotti, what does it mean to you then to be this involved in something that so many people would rather turn away from? People say, I know it's bad, I don't want to deal with it. They don't even know how bad it is. You got a lot going on, in all seriousness. People know that, I think, in this room. If you can make time for this and put time towards it, what are you asking everyone else to do?
I think everybody should always stand up for the things that they feel is wrong. You know, when we first started seeing the pictures coming out of Parchment and the videos, I think if you're human, you can't look the other way from that. You know, some of these videos and pictures we were seeing, you know, when I first seen them, I thought they was like fake. You know, we didn't even think it was real, you know. And once we started communicating with me and Team Rock, we got even more footage and even more pictures the deeper we got into it. And it was unbelievable. But again, for me personally, being that close to Mississippi and Parchment and having a lot of different family members who grew up, who did time in different prison facilities, you know, it's supposed to be a rehabilitation place. Mm-hmm. It ain't supposed to be a torture hall or something like that. So, you know, I think you just have to stand up for the things you think that's wrong in life.
Stand up for what you think is wrong and try to make it right. Thank you to Ms. Henderson and Gotti. Thank you so much. Thank you so much.
Thank you. Thank you. Look.
As promised, we're now going to turn to a part 2 on this, and we designed this deliberately because we want to hear the reality, the humanity of this. But the entire way that this summit has been organized is to make sure that we're also going forward towards action. And so I want to bring out, as we conclude part one and bring out part two, we talk about action on the ground so no one else has to go through that. Craig Haney joins us, a professor and an expert on the actual physical, psychological, mental harm of the prison system. Daryl Norcott runs community partnerships at Amend, which is a solutions program. We're going to get into that. And this was important to the organizers. I want to emphasize Kim Rowley has spent 27 years in the corrections field, brings that experience, that perspective to how do we actually change this together. So again, a big thank you to the people who started this. I think that that story weighs heavily on everyone's heart. And now we turn here, we want to start basically with how does this actually work? I did want to give a warning that there will be some photos. Gotti mentioned the photos, the documentary evidence. Number one, it takes people fighting to even get the facts out. But some of the photos are disturbing, and I want to warn that. That is going to be on the screen for, I believe, part of part two. What is the impact of this prison system?
Well, this prison system, the prison system you just heard about, is at the far end of a spectrum. It's different in degree, but not in kind, unfortunately, from the prison systems that exist throughout the country. We've got about 2 million people still in prisons and jails in the United States, and they are experiencing many of the same kinds of traumas that you've heard about. Not quite as extreme as at Parchment, but the prison system in the United States does real damage and real harm to millions of people. You heard of the era of mass incarceration. The era of mass incarceration was also an era of cruel incarceration. We have been doing unprecedentedly bad things to unprecedented numbers of people now for decades, and it frankly has to stop. It has to stop only when people like the people here and the people who are part of these movements demand that it stop because of the damage that is being done, not just to the individuals directly who experience this trauma, but to the families and the communities that are related to them. Parchment was an extreme, but it's sadly much like many other prisons in the United States, as some of these images that you will see illustrate.
Kim?
Yes, sir. I think that it takes prison leadership from the top to set the stage for this, to allow the leaders throughout our Department of Corrections to give them the authority to, do some different things in their prison to normalize and humanize their environments. So it starts with our leadership at the top. Gotti definitely had a very important message there where it takes people to stand up for what they believe. And
Do you think some of the colleagues you have, people in the corrections side of it, know and sense something is also wrong?
Yes, sir, but I think the tide is changing in the Oregon Department of Corrections. Our director, about 5 years ago, led the charge and said, we're not going to do business like this anymore. And so she gave us the opportunity to know what was in our hearts and know what we were doing was wrong. And with Amend, we were given a pathway to make the change. Many of us knew that we wanted to change, we just didn't have a direction. We didn't know what direction to go.
Right. So let's go to Marcy on how you actually force change, why Ms. Henderson and Gotti and Rock Nation put their faith in you and your team, and how there are incremental victories, which is not to say this is fixed, obviously, but you, the Justice Department, and lawsuits have forced already some start of change. And I think you can talk to the evidence, some of the pictures we'll see, as well as how you're making change. And then Daryl will tell us about what could go beyond just fixing the worst of the worst prisons.
Well, shedding a light on what was happening, sort of like Gotti said, you heard all these rumors. I had always heard, I'm from Mississippi originally, I grew up there. So I had always heard about Parchment, and we were almost taught that it was supposed to be a horrible place. I don't think Mississippians especially, and a lot of people that work in corrections, really have a picture of what it should be and can be, which is why I think your organizations and what you're doing are so important. But some of the pictures behind me, you can see were snuck out of Parchment. They're not allowed to have cell phones. They're not allowed to get this information out. In fact, the one thing the state of Mississippi spent money on was cell phone jammers for the prison to try to keep this information from coming out. So having people like Gotti, having Team Rock, having Jay-Z, having all of the power and the resources behind them to get the message out, and then to force change. And one of the things I think that we did differently that may help in other places with other prisons was we treated this almost like a mass tort case. That was my history as a lawyer, so it was by default, and it just happened to work. But, collecting all of that data, not just from one or two people that are there, not just from one or two stories, but from hundreds of people that we interviewed inside of Parchment. And while the state can go after Ms. Henderson's son and try to attack his background, or go after some of the other victims or one or two class members, when you have hundreds of people telling the same story, dozens of pictures coming out that are graphic from all over the prison system, from all over Parchment, I think that's what really makes the difference to make a change, and analyzing that data en masse and pushing it out en masse.
And what court ruling did you get?
Well, we have been working now, we're in pre-class certification, but actually since the Department of Justice report came out in April, that has really made all the change in the world, and we're so lucky and thankful to Reform, that organization that helped us, into Team Rock, for when we met with the DOJ, showed them some of the pictures that you have seen, shared with them some of the information that we had collected in the aggregate, and we had those numbers and could present it to them. All of that got wrapped into that DOJ report, and so now the Department of Justice is who the state of Mississippi has to deal with and has to face and has to negotiate with. So not only are they dealing with our class action suit, but they're going to have to deal with the federal government as well.
So alone, it's almost impossible, but in going together, you had the strength in numbers, and you have multi-track. You've got a public campaign to keep the pressure on the politicians. You have a class action, which allows you civil court remedies, no matter who's in charge of the Justice Department, which can change. And then you have this April report that finds Eighth Amendment, basically torture conditions at this prison, and the DOJ is involved with the power of federal prosecutors, subpoenas, which can send people to jail.
That's right.
To get change. And I would just add to that, but as we go to Daryl, something very rare, this Justice Department also recently obtained a conviction of a deputy warden at that same prison for prisoner abuse, which is incredibly rare. And that's an independent process. That's facts and evidence catching up with someone in court. That's the worst of the worst, Daryl. Then you have ideas. Believe it or not, this is a necessarily grim topic, but then there's hope. And Daryl, you're not just talking about how do we deal with basically irreversible losses. We can't bring these people back. We can only seek a measure of justice. You're talking about how do we fix this whole broken system.
Yeah, and this is the nature of the problem. So it's like, I'm just struck by how many levels need to be sort of activated for change to really take place, for generations-long systemic harm that we're facing from these punishment systems. And so Amend is an organization based in San Francisco at the University of California, San Francisco. It would not exist without Professor Haney, so I always just feel that I'm honored to be on the stage with you, and his scholarly work and research really has allowed us to have a platform upon which to build our programming work. And Amend is a public health and human rights organization that works to immediately change and address the dehumanizing effects of U.S. prisons. And so what that means is that we have multi-year immersive programs. We're very small. We're primarily in the Northwest. But we bring correctional professionals, leadership to Norway, look at dignity-driven, health-focused approach to working on in correctional facilities, and in this way, looking at health as really the key factor and how we can create this change from peer to peer that is so essential in this country. And so in Norway, they have a saying that you go to court to be punished, but you go to prison to become a better neighbor. And it's really the beginning, and it ends up sounding kind of radical in a way in the United States, but it's just common sense that you would want to have a system that at the very, very least is working with people, treating them with dignity and respect, and working to make their lives better and to create change in a very ground level way.
Craig, what does that look like psychologically if incarceration is a period of time, but not something that breaks people? We heard about people being broken to the degree of even hurting themselves. But what does it look like psychologically if it works?
Well, it's profoundly different. It's so profoundly different that we actually have to take people to Norway to see it, because it's really difficult to describe what a prison looks like and feels like when the people who are confined inside are regarded with dignity and their personhood respected. They're not destroyed. They're taken temporarily out of society, and the Norwegians then surround them with whatever they need while they're incarcerated. And it is literally that dedicated a process. The other thing that's almost impossible to describe is the nature of the interactions that take place between the people who are incarcerated and the people who are incarcerating them. They're normal, friendly, dignified, interpersonal interactions unlike anything you have ever seen take place in any American prison. And it's so transformational that when the American correctional officials and officers see it, they're almost immediately changed by the witnessing of something that is so fundamentally different and yet so simple and human. It's what we do that's wrong and contorted, not what the Norwegians do, which is a natural human response to another person. That's what gets disfigured in American prisons.
Number one, it's so important to know about a place where that's working. Number two, who thought you'd be hearing so much about Norway today? Shout out to Norway. I never even think about Norway at all. To Kim and Daryl, then, the deeper American problem is something we all know, and sometimes we talk about it, and sometimes we just move past it. A nation that's built on dehumanizing people and treating human beings as not human is going to have a hard time with reforms that require the actual dignity of all human beings, including, as Ms. Henderson reminded us, people who might make some sort of quote-unquote mistake, or people who are being treated as less than human simply because of their identity. How does that figure in at the root cause? First to Kim, and then Daryl.
Well, so it starts out with, at a very basic level of just communication. Communication is the most human thing that we do in the world with each other. That's what we're doing right up here, right now. That's what today's all about. And so people make mistakes, but that doesn't mean it defines them. So I know in my prison, we invest heavily in conversation with our incarcerated people, and just investing in their stories, learning about their families, learning about their backgrounds, and what it is they need to be successful, and then trying to help them find those needs in our prison system so that they can become successful. And that right there is humanism, because we all have needs. We all need help from our neighbor, and while they're incarcerated in prison, I'm their neighbor. I'm their supervisor. And so on a fundamental level, it's just investment in the people that are incarcerated in our prison.
I'm going to go to Marcy and then Daryl for that, and a final thought about what people can do. What is exactly next, though, in what you are doing, which is leading these efforts to use power to force change?
Well, there's actually been a lot of change at Parchman since we started, right? Since the first time Dr. Haney and I walked through there, they've now, I think there was an article this week that you may have even mentioned on your show, where they now have air conditioning for the first time in 121 years in Parchman. So pushing...
And the DOJ found temperatures up to 145
degrees,
which is lethal.
145 degrees. So Yeah, so I think those incremental changes need to be celebrated. They need to be pointed out as much as the problem is pointed out, because that public shaming or public appreciation matters when it's politicians that control these things, right? So we've changed the medical provider there. We're still not happy with the medical provider. We've changed the food provider there. The facilities themselves have been updated, none of which would have happened but for the work of Team Rock and Gotti and Reform and all the other organizations that have been a part of it. I do think the one other important thing is we learn so much from other organizations that work in this space, and to be open to helping each other and joining together, which is why I think this conference is so important, the united part of it. I think so many times in the reform space, and I'm new to it, there's almost bickering back and forth. I'm not sure that everybody really gets along all the time, and pooling our resources, pooling the information that we've gotten, working together to try to make these changes, I think makes a big difference, and that certainly made a difference in Mississippi.
Appreciate it. We've tried to cover some of the ground here in these two parts. I want to give Daryl the final word, given that you're thinking big, so on both the humanity we discussed and what you want to share with everyone today, because we have a lot of people here today who are active, who are connected. I didn't do acknowledgments to keep it moving, but I see DAs here, I see civil rights advocates, I see great journalists. So what do you want to say to the whole room as our final thought?
Mass incarceration in the United States is a public health crisis. It requires a public health response. Okay? It's very simple. When we talk about a health-focused approach to working with people who have caused harm, well, then there's two things that we need to acknowledge. One, that incarceration, the act of taking someone's liberty away, should at most be the very last resort. Two, when someone is confined, from the moment that they have lost their freedom, there should be a system in place, at the very least, that works with them to become a better, healthier community member. And those are just simple tenets that Professor Haney is alluding to when we say that they sound odd to us in the United States, but in fact they are common sense. Correctional professionals are at the front lines of a health crisis, of a health epidemic. This is a tremendous opportunity. They should be able to provide community standard patient care and go to bed at night thinking and understanding and unconditionally that they've contributed to the betterment of improved the life of someone that's been in their care. So I just want to leave you with this thought that this is possible. We believe this is a social movement that can grow person by person, and that when we start talking about dignity-driven approaches, treating people with humanity and respect, then that leads to health, which is in fact true public safety.
Thank you to all of our panelists. I think it's a fitting note to end on. Thank you so much. Let's keep up the action.